Welcome back to Startup Health Now. I'm your host, Logan Plaster. Now, normally we use this show to bring you interviews with up-and-coming founders in health innovation, specifically founders who are part of the Startup Health community, which currently includes around 500 companies from 29 countries. My job with this podcast is to share with you the inspiring progress being made by healthcare startups in the hopes that we can make important connections and speed up innovation even more. Today, however, I want to step one level up and talk a bit about startup health and our bigger vision. My guest on the episode is Chuck Henderson, CEO of the American Diabetes Association. The ADA is a leading advocacy organization for all people suffering with type 1 and type 2 diabetes, promoting research, fundraising, education, you name it. The reason I invited Chuck on the show is because he recently became a member of Startup Health's Impact Board. And the reason why that is important is that our Impact Board model is core to our philosophy and our model for innovation. Let me explain. The fact is, there are literally thousands of amazing healthcare founders and startups working away at amazing new ways to cure disease, to manage patients more efficiently, to make life better for doctors and nurses. But the vast majority of these ideas won't make it to market. They won't have their desired impact on real people because they are siloed efforts. To truly change healthcare for the better, we need a radically collaborative approach, which is why Startup Health created impact boards that bring together top minds from various industries, from pharma to academia to hospital management to patient advocacy to investment. We bring these folks to the same table for a discussion with early stage founders with the goal of breaking down those common barriers and getting innovative solutions to market. We've got one overarching impact board, and then we create Health Moonshot specific impact boards as well. That brings me back to my guest, Chuck Henderson. I'm incredibly excited to see how his voice and experience will add to the Startup Health Impact Board in coming months, specifically as we bring new diabetes-focused founders through our program, help them survive the valley of death, and move into healthy commercialization. It's all about going beyond ideas and connecting the dots. Bringing these amazing startups from concept to impact is the key. As you'll hear in the conversation, Chuck shares this passion, so let's get into it.
What excites me, about leading the ADA is that, it's wonderful to be able to have an impact on lives, have an impact on transformation. As you know, there are 133 million people in the U.S. living with either prediabetes or diabetes. And so just from a personal point of view, my grandmother and my uncle passed away of complications of diabetes. And so when people say, well, Chuck, why did you go into that? Well, that's my why, because I do know and I fully believe if they would have had the access, the education, and the tools to be able to thrive living with diabetes, I do think they would still be here today. And so when I think about the impact that I can have on lives with educating, with resource, and just being out there, being a positive influence, because, when you think about diabetes, the ADA focuses on type 1, type 2, and gestational. Well, type 1 obviously is hereditary, DNA, type 2, environmental things based on zip code, based on how you were raised, based on what you put into your body. Then gestational, comes from a maternal, health thing. But, the good news is all those, you can still live and thrive. But really at its core, it's about education, it's about access. And so that's what really motivates me about leading this great org in the ADA.
I'm guessing that a big part of your job is to carry the torch and continue the great work that's already happening at the ADA. And yet you're also called to be a change maker. And so I'm wondering if there's anything in particular that you really want to shift during your tenure in this position.
Yeah, I would say, and that's a good point. I would say that, people paved the way before me. And so the ADA has been undergoing some significant transformation for a while. And so I think what I can bring, or what I know that I can bring, is that we move the organizational, Logan, from more of a transactional to a transformational aspect. And so what I mean by that is that we need to bring scale to this cause. We can't do it on a one-off basis. And so when we think about, partnering with companies like StartUp Health, like Abbott, like Walmart, like Baxter, like Genentech, we need scale. We need public-private resources and able to address this critical problem, because from a metabolic standpoint, diabetes affects every part of your body, from your eyes to your organs to your liver, your kidneys, your feet, your toes, everything. And so, it's going to take resources, and it's going to take scale, and it's going to take us attacking this issue community by community by community, and really putting the patients first and really listening to the patients. And so I really think that the ADA, is not only a convener, but we're a change agent for good as well.
Yeah. At Startup Health, we believe that health transformation really stems out of radical collaboration. You mentioned some of those ideas and how important it is to the ADA. Have you seen encouraging signs of collaboration, of sort of the walls coming down, the silos being lowered, and networks being shared? Could you give any examples of optimistic collaboration?
Yeah, I would say one thing that we've done from an ADA standpoint is that we really pushed from an advocacy standpoint, which is one of our best assets within the organization, advocating for people that can't advocate for themselves. As you know, insulin is a big affordability issue, right? You have people in homes that are rationing insulin. So one of the things that we got done, thanks to Congress and thanks to the government, is that we were able to get insulin capped at $35 a vial from a Medicare standpoint. And now the next step is to get that across the aisle and get it pushed from a commercial pay, right? And so immediately that brings down, that levels up the access so that it could be affordable. Another example of that is clinical trials, right? Now, from an FDA standpoint, from an approval standpoint, you have to be inclusive of clinical trials, because for a long time, there was only one segment of the population, right, that was a part of the clinical trials, for obvious reasons, for, lack of trust for people of color. But now, the government, and the FDA is coming and said, okay, if you want to get these drugs approved, you have to do clinical trials for all walks of life, for all, for people of color, for all different ethnicities. And again, it just levels the playing field, and you are building drugs, or you're developing drugs around everybody versus one particular subset of the population. And so I know for a fact that the ADA plays a critical role in policy and legislation, and in advocating for people around access, around affordability. So yeah.
When you talk about increasing access and making insulin more affordable, you're talking about collaborations with some of the biggest names in healthcare. You mentioned Abbott. You're doing advocacy in Washington with regulators. Startup Health represents that early stage innovator, that tinkerer, that change maker that's maybe still at a team of 5, 6, 7 people, hasn't even raised their big Series A yet. What role do you think that startups play in catalyzing innovation in diabetes?
So I would say that, it's basically an open playing field for innovation. One of the things that attracted me to Stephen Krein and his organization is just the thoughtfulness, right? One, the intentionality, and then the business model of solving for the 12, 13, 14 moonshots. I mean, that's incredible, right? So, you have all these brightest minds, that are disparate, but then how do you bring them together, under one roof to make, really meaningful change happen? And I'll give you an example of that, COVID, right? COVID, showed a bright light to many different things, many different inequities, but in a positive thing, what it showed me is that we have the ability to come together fast and solve really, really critical problems. And I think that, in a commercial term, that's what Startup Health represents, right? They're able to scale, but also bring in the right people and solve the right problems. And ultimately, I think that they're going to be wildly successful in solving for some of these chronic illnesses. So yeah.
As encouraging as some collaborations that you've seen have been, there's always room for more. And so one question I have for you is if you could get two stakeholders in the room with you or work together by themselves, if you could, facilitate a conversation with the right people, whether it's in pharma, whether it's in access, regulation, who might that be? And what might you do to kind of increase collaboration in diabetes?
Yeah, so what I would do is first, I would bring in, the most senior heads of the government, right? And then I would bring in some of the most senior folks, from a corporate standpoint. And then I would bring in real life patients, right? So that they could actually hear their stories, and then so, from an advocacy standpoint, one of the things I love about this job is being able to go on the Hill and talk to your Congress people and talk to different people, of influence from a policy standpoint, but we have to get in the room. We have to have very honest conversations with each other, And I think the most important thing, Logan, is checking your ego at the door. I think from an ego standpoint, we all have egos. You have an ego, I have an ego, but at the end of the day, it has to be much bigger than just the individual, right? Because every day I wake up, I say, what can I do to make the lives better for the millions of people, not thriving with diabetes that are suffering every day, right? And so at the end of the day, I look myself in the mirror like, have you done what you can do to move the needle in the positive way on people living with diabetes? And I think that if we could just check our egos at the door and just sit in the room, okay, how can we allow for all of us to have better lives, right? To live a full life with our families and just, enjoy however much time we have on this earth. I think that we would be in a much better place. So
something that's always interested me in my conversations with health innovators is that there's innovation in technology, and in your case, that's new therapies and platforms, and then there's innovations in business model, which is taking what we already have and making it more accessible. And it's such a big deal. You mentioned that already with the issues of cost and geography and just getting the kinds of technologies have been developed for 2 decades into more hands. I wonder. Both are exciting in their own way. And I'm just kind of curious where your head is at in terms of focusing on brand new therapies versus getting the best of the current market to more people.
Well, I think it needs to be a balance, right? So, we are living in probably the best technological time that we've ever lived in. But again, it still boils down to access. And to your point, I do think it needs to be a balance too of getting the best therapies in the right hands as well. But we can't slow down innovation, right? Because innovation, is the key to, efficiency, living better lives. And all that great stuff. But I do think it needs to be a balance. So, I don't know if I exactly answered it, but it definitely needs to be a healthy balance. I definitely think there's still a lot of wonderful therapies out there that people don't have access to, but then with innovation, it makes it more efficient, it makes it better, it makes the efficacy better. And so it definitely needs to be a healthy balance. So, yeah.
I know it's hard for someone in your position. You can't pick favorites, but is there an area of innovation that you just are getting the most excited about right now, whether it's a digital platform that helps children with diabetes or whether it's a new therapy for hypoglycemia? Is there an area of innovation that you're just getting excited about?
Yeah, I would say two. I would say stem cells as it relates to, a potential cure for type 1 diabetes. And I would also say CGMs, continuous glucose monitors. I would say that's a game changer, right? And so, I would say that I wear one. I'm not pre-diabetic and I'm not, I don't have diabetes, but I was getting to the point where my numbers were going up a little bit, and I got a prescription. I get real time results. I drink water, I drink this, I eat this. That line moves, right? And so you want the line to be more consistent,
Is there one sort of habit or behavior that has shifted in particular?
I grew up, loving soda pops, So I will tell you that, one of the things, that I've shifted, especially in moderation, is that I've really limited my pop levels and my juice levels and not consuming so much sugars. And I mean literally, I used to have a belly and now my belly is a little bit flatter now. So, but again, things that you put into your body wearing certain devices, it shows you. If you drink something, if you eat something that you're not supposed, it spikes.
Yeah.
It's very simple to understand.
It must be a huge help in your conversations, in your position, to have it and to understand yourself better.
Yeah. And I'll tell you, one of the things that has been, ultimate blessing in this role is, believe it or not, I think I've become a better, healthier citizen by being in this role, Logan, because literally it's in my face.
Yeah.
Every day, good, bad, or indifferent. And so, as a leader, of the ADA, I have to be representative of what I'm trying to do. So I want to be my best self and my healthiest self so I can continue to lead great transformation in ADA. So,
Awesome.
I'm all in, man. So
I love it. I love it. Okay, last question. 2024 is coming soon. What do you hope to accomplish as a part of the Startup Health Impact Board as you look at the other industry leaders that you can interact with there and the sort of the innovation community that's collaborating there?
Yeah, you know what? I'm still relatively new to the board and on the advisory board, but for me, Logan, at its core, it's been more of a learning for me, listening, to all the bright and really intellectual people, on the calls. And so for me, it's just really listening, learning, to, how I can become, not only a better leader, but, lead better transformation. I think we are in a really good place from an ADA standpoint, but it's always more. That I can do. It's me personally, selfishly, just been a sponge in the room, just absorbing, all the different, ways of doing things, because, there's 10 different ways to skin a cat, right? And so there's enough intellectual horsepower on those calls, that, I can really learn something from. So
I love that idea, that entrepreneurial spirit and that energy is flowing both ways from a startup, a small company up to a $200 million organization with a long history, and it's flowing back and forth.
Yeah, no, it's great, man. I think this is one of the great causes, in the world. And so, my wife always asks me, what do you, want to be remembered for, and I would just want to remember, that I did good, that I impacted the world, in a really, really positive way. And so, I don't think I would have done my job, if we don't help bend the curve on diabetes. I know it's fast growing. It feels like it's out of control, but I do think, being a part of, boards and organizations like a Startup Health, having some really, really great partners, that are really interested in putting patients first, I think we will get there.
Nice. Chuck, thanks for taking the time with me today, and I appreciate the work you're doing. Very excited to have you on the Impact Board, and ready to watch what's going to happen in 2024.
Yeah, no, thank you, Logan. And I really appreciate your time. Really enjoyed this today. So thank you.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.